Good day, I am Rica Leonico, and I would like to greet you a pleasant day. May I present to you the study I have prepared regarding the securing and implementing a militarized response to a COVID-19 pandemic in the Philippines, disciplining Filipinos. The COVID-19 caused widespread disruption to everyone's usual way of life and practice in the Philippines and other parts of the world. Despite the strict health regulation in place in each country, the disease continued to spread and claim the lives of countless people. The Philippine government is developing several strategies to reduce, if not eliminate, virus transmission in its citizens' body. Many measures were designed to keep children and the elderly from leaving their homes, mainly young and infirm. Lockdowns of varying degrees of severity have been deployed across the country. During lockdown, uninformed personnel ensure that the policies and procedures are followed to the letter. The Interagency Task Force, or IITF, which oversees the government's response to COVID-19, issue an order that governs law enforcement during the outbreak. Using military strategy, the President implement the regulation and each IATF directive is becoming standard procedure. Because of the introduction of lockdowns and other form of quarantine regulations, it appears that the human world has come to a screaming stop. Filipinos become the focus of disciplinary and law enforcement efforts due to their constant threat to public health and order. According to the report, the threat authoritarian, the tendency and deeply engaged class produced, motivated, and targeting of Filipino in the country. Arrest moved by the government, they decided to loosen quarantine restrictions because they had to think about the health of the country and the country's struggling economy for a long time. The economy had been in a state of lockdown. This study didn't just talk about how important it is keep things in order and follow the rules. It also made sense of the government to have more power to keep people safe. As a result, it also gave a two-side pictures of society. Several commentators have referred to the Philippine response to COVID-19 as one of the most drawn-out histories. Lockdowns were imposed across entire province and cities, and wearing masks and social distancing was strictly prohibited. As was mobility enforced, it was decided to take punitive measures against those who break the rules. It was the government that placed a great deal of trust, keeping order to ensure that all health protocols were followed were the responsibilities of the police and military personnel on the ground. My answer is the prolonged lockdown had several harm the economy. The Philippines saw increased COVID-19 cases as quarantine restrictions were gradually eased. Nearly five times as many patients were confirmed by the end of July 2020 as there were on July 1, 2023 deaths and 65,178 recoveries. The healthcare system in the Philippines is under increasing strain, particularly in COVID-19 hotspots like Metro Manila. By the end of July, all of Metro Manila's ICUs, isolations unit, and ward restrictions were eased to promote economic activity. The number of COVID-19 cases rose. Up researchers believe that an increase in testing capacity in the Philippines is to blame for the recent uptick in cases. Thus, the July 2020 positive rate showed an upward trend which indicates an increase in virus spread. Even though COVID-19 cases have increased dramatically, testing and contact tracing have not kept pace. As a result, they missed their May 2020 deadline and July 2020 deadline to conduct at least 30K and 50K testing respectively. By July 31, 2020, the government had only reached the 30,000 mark seven times. The government screened a daily average of 25,703 people from July 1 to July 31, 2020. According to the government, their failure was due to the scarcity of supply and human capital. Although the program failed to reach its target of 2% of the population, it did not push over a million Filipinos, nearly half of the government's target population, according to SGERA 2020. With this declaration of enhanced community quarantine issued by President Duterte of Metro Manila and all islands of Luzon, effectively imposing a lockdown and quarantine on the country's most population's island group. Few days, major cities across the country were put on lockdown as well. We are in a fight for our lives, said Duterte. In stark contrast of his previous nonchalant demeanor, our adversary in this applying the discussed topic in Module 5 on how globalization affects the sociocultural development of the Filipino youth during the pandemic. As a result of government efficiency and globalization, fewer travel restrictions where globalization and protectionism are government response to major global events like a health crisis. Consistency in existing trade agreement, a greater desire to learn from others, and perhaps a government's confidence in dealing with the pandemic are all factors that contribute to a government's pandemic response capability. Determining whether the globalization index can improve global infectious disease forecasting while taking government effectiveness into account will require more research, expect from frontline or critical professionals like police officer, military personnel, and healthcare providers. When viewing our capabilities, I believe President Duterte's military approach to the COVID-19 pandemic in the Philippines is only appropriate but not effective. Our third world status means that we are unable to meet the urgent needs of our own country at this time. We will not be able to produce the vaccine right away, so the government will have to purchase it from countries that are able to do so. Taking action to prevent the virus spread is entirely appropriate for the federal government. Lockdown should be implemented in various parts of the country to prevent individuals from spreading disease to one another. However, there are times when the rule enforcer is abusive, resulting in many complaints being filed against them because many people are being penalized for failing to comply with the rules and regulations in effect. When viewing our capabilities, I believe President Duterte's military approach to the COVID-19 pandemic in the Philippines is only appropriate but not effective. Our third world status means that we are unable to meet the urgent needs of our own country at this time. We will not be able to produce the vaccine right away, so the government will have to purchase it from countries that are able to do so. Taking action to prevent the virus spread is entirely appropriate for the federal government. Lockdown should be implemented in various parts of the country to prevent individuals from spreading disease to one another. However, there are times when the rule enforcer is abusive, resulting in many complaints being filed against them because many people are being penalized for failing to comply with the rules and regulations in effect. The government's militaristic stand is only reasonable. The use of a face mask, a face shield, a social separation are relatively simple procedures, but many people are still unaware of how to do so. As a result, the situation in our country has deteriorated significantly.